In the 1960s, the healthcare climate was changing. The number of general practitioners was declining, and the national discussion had turned to the central role a generalist should play in the healthcare system. It was at this time the specialty of family medicine was born. For the first time, there was a physician who could provide comprehensive healthcare for the whole family, young and old, male and female, from birth to death. Flash forward to today. The healthcare climate is changing again. The national discussion has turned to healthcare reform, reforming payment models and healthcare delivery, knocking down barriers to care and increasing access. In the midst of these important discussions, the U.S. faces a shortage of 90,000 physicians by 2025. But the problem doesn't end there. 50 years ago, about 70% of doctors in the U.S. practiced primary care. Today, only 30% of doctors in the U.S. practice primary care, which explains why 60 million Americans lack access to a primary or family doctor. Yet, U.S. adults who have a primary or family doctor have 33% lower health care costs. They're also happier, healthier, and spend less time in hospitals. The formula is simple. Americans with a primary or family doctor have better health, better care, lower costs. But how? How does family medicine make the difference for patients? Relationships. Being paired with one doctor who knows your history and understands your community, the context within which you live, work, and play, sets you up for better health across your lifespan. Right now, about 75% of all healthcare dollars are spent on patients with one or more chronic conditions, many of which can be prevented through team-based continuity of care provided in a family medicine clinic. And 1 in 5 people visit the ER for care they could have received at a much lower cost from a primary or family doctor. We know that our healthcare system is broken. That's why the topic of healthcare reform isn't going away. We also know that we have a solution: family medicine. At the University of Minnesota, we have a vision for family medicine, a vision for change, for transformation. We want to make individuals healthier, families healthier, communities healthier. We want to deliver on the promise of family medicine. How? Through advocacy, by promoting core principles and values of family medicine, ensuring care for the whole person. Through education, by being a leader in training family physicians for Minnesota and beyond. Through patient care, by improving the health of underserved communities and populations. Through research, by driving research in health disparities, healthcare delivery, and population health. We need your help to make this vision a reality. Will you join us? Will you help fix our broken healthcare system? Will you help ensure that individuals, families, and communities can have better health, better care, and lower costs? Together, we can deliver on the promise of family medicine. To find out more, go to z.umn.edu/givefamilymedicine.